COVID-19 and influenza are both respiratory viruses. Influenza is caused by a virus, influenza A and B, and COVID-19 is caused by a new coronavirus called SARS-CoV-2. COVID-19 and flu do have many common symptoms. The most likely are runny nose, fever, cough, shortness of breath, and also body aches and the potential for nausea or vomiting. And so the challenge with the two is there's a lot of overlap in symptoms, which makes it really hard to tell them apart going into flu season. Both can really be anything from fairly mild symptoms to more major symptoms that can even require hospitalization and lead to more major complications like pneumonia, organ failure, or other things we certainly want to avoid. The virus that causes COVID-19 can lead to a loss of taste or smell, and that's something we don't see with influenza. Flu is most likely to be transmitted within 3 to 4 days of being exposed and to show symptoms. COVID-19 usually will show up anywhere from 2 to 10 days after exposure. Flu usually is spread within 5 to 7 days of getting it. COVID can be spread for a longer period of time, and usually we'll use a thought of about 10 to 14 days as a safe time frame for COVID. Higher risk for both flu and COVID-19 would be similar. It's people that have many of the comorbidities that we'd think about: diabetes, heart failure, kidney disease, asthma, COPD, any conditions that suppress people's immune system. Both viruses spread very similarly. It's spread through respiratory droplets and aerosols that come out with coughing, sneezing, talking, and those respiratory droplets or aerosols are breathed in by individuals, or sometimes can lay on surfaces, and people can touch those surfaces and then touch their mouths or eyes or nose, and that can transmit the virus. The precautions that we're taking for COVID-19 are also very effective with flu. As a matter of fact, in different parts of the world, like Australia, where they've had masking and universal precautions in place, they saw the flu season there go down substantially and not nearly as much flu. So we're hopeful we'll see the same things here. So just to reiterate, really the things you can do to stay safe are making sure you wear a mask when you're out in public, making sure that you social distance appropriately, at least 6 feet from individuals that aren't your immediate family, making sure that you're washing your hands frequently with soap for at least 20 seconds or using an alcohol-based hand sanitizer, and then making sure that you're sanitizing surfaces on a regular basis. Unfortunately, at this point, we don't yet have a vaccine for COVID-19, but there's many smart individuals that are actively working on that now, and we hope to have a vaccine for COVID-19 in the near future. Thankfully, we do have a vaccine for influenza that we've had around for some time and is very safe and effective. Every year, the flu vaccine takes the 3 or 4 strains that are most likely to show up each year, and that's determined based on flu around the world, and so other parts of the world in the southern hemisphere have flu before we do, so we know sort of what's coming our way, and that's what ends up in the flu shot for the year. Flu season in the United States is usually October to May, and so most places have flu shots right now, and I would encourage you not to wait and go ahead and get a flu shot anytime you can. The safest place really would be at your provider's office. We have all kinds of precautions in place to keep you safe with coming in. We also have flu shot days, some of which would allow you to even stay in your car and get a flu shot. Alternatives that would also be great would be pharmacies or your local health department, or an Allen County Super Shots would be a good option too. It's even more important this year because of the overlap in symptoms between COVID-19 and flu. And since it's difficult to tell the two apart, if you get a flu shot and lower your chance of getting flu, it makes it much easier to distinguish the two and help you get better.